let's look at the truth. What is the truth? The truth when it comes to your patients. When they come to see you, are they looking to have a desire fulfilled or a need met? And when you look at your patients, when you interact with them, are you focused on their desire or on their need? When someone comes to you and they're in the chair and they're in pain, their desire is to not experience pain. The need is for you to resolve the pain. And that could be through any number of procedures, but the need is your procedures that eliminate the desired result, which is no more pain. Patient comes to you and desires a beautiful smile. That's their desire. The need is for whitening. The need is for aligners. The need is for veneers. That's the need. They need those things to match the desire of a beautiful smile. And below that desire is probably multiple desires. Why do they want the beautiful desire? There's another desire below it. That could be no longer being afraid to smile. It could be wanting to get the job that they really feel they deserve. It could mean being confident enough to smile and engage the person of their interest who they would like to relate to, be it as a friend or a romantic partner. So the desire is to have more, be more, do more. That's the desire. But the need is to get a beautiful smile. I need a beautiful smile in order for my desires to be fulfilled. So when you are looking at a patient, it's important to recognize that you may see a need. You have a crack here, it needs to be fixed. You have a misalignment, it needs to be fixed. You have decay, it needs to be fixed. You're missing a tooth, it needs to be fixed. But ask yourself, when you're looking at that patient, when you see this fellow human being in front of you, what is their desire? There is a missing tooth. How do you feel about that desire? Or, pardon me, how do you feel about that missing tooth? Well, it bothers me when I'm eating and after dinner I have to clean out the food that's there. Or I don't like the smell I get from that area, or it just feels weird. And how do you feel about that? Well, I'd like to not have to clean the food out in that missing space. I'd not like to have the odd smell that I get occasionally. So your desire is to not be hassled by the fact that you're missing a tooth, not have the aroma or the embarrassment of food rotting in your mouth. The need is for a partial denture or an implant or a 3-unit bridge. That's the need. You need that in order to have your desire fulfilled. So recognize that for all of us, we have needs, but the precursor, the precedent, that which is above the need is the desire. So when you relate to your patients, seek to understand the desire, relate to the desire, understand the desire, and then guide the patient to understanding what they need. Because what they need will then give them what they desire. And on that basis, they then will say yes.